Hi there, my name is Kevin Chen. I'm a neurosurgeon, and I an appointment here at the University of Michigan Department of Neurosurgery. And I also work with Dr. Eva Feldman on our research collaborations. I also practice neurosurgery in Grand Rapids, Michigan, with the practice of Great Lakes Neurosurgery. So I just finished my first official week back in the lab, which was fantastic. I spent 2 years during my residency in the laboratory working with Dr. Feldman. So in some ways, this is kind of a reunion with a lot of the same faces and a lot of the same folks in the same team I worked with before, kind of picking up where we left off almost. And so it's kind of nice to rejoin the team, catch up again, and kind of get my head back into science. I actually got my introduction to Dr. Feldman and her lab and her group when I was a resident because she was involved in the initial stem cell trial for ALS, assisting on those surgeries during that trial, that phase 2 trial. So I kind of got a glimpse at how, because ALS is not traditionally a neurosurgical disease, but I kind of got a preview of how surgeons can be involved in clinical trials and this type of research and stem cell research, and how we can work with teams of neurologists and scientists and things to really advance things to the clinic. I think that I find the idea of creating stem cells from a patient's own tissue and correcting them in some way or modifying them, kind of engineering them to become a patient's own therapy, is sort of my my long-term goal. So a lot of our current experiments are structured around using those strategies, and again, kind of with sort of a keeping in the back of our minds that we do eventually want to move this towards a realistic treatment for patients. So my main focus is on amyotrophic lateral sclerosis and looking at kind of stem cell-based approaches to both understand what happens in ALS and also ways to treat it. My sort of really focused interest in ALS is in inhibitory interneurons and how they regulate the motor neurons. And there's some evidence to suggest that the disease actually begins first in these interneurons, and then when you lose the regulation of the interneurons, the motor neurons kind of go crazy and fire too much, and that's something called excitotoxicity. The overexcitation of the motor neurons is what leads to their cell death and eventual symptoms of ALS. It's been an interesting experience for sure. I think in the beginning we realized how much we could get done virtually, with meetings and discussions by computer or phone and email, and then now that the laboratories are actually starting to slowly open up, we can actually implement these plans and kind of do the actual manual labor that it takes to answer the questions and discussions that we've had. So, I would be looking to see what kind of abnormalities those are, whether it's genetic, whether it's a difference in RNA translation, whether it's the synapses they form, whether it's the growth factor signaling, if they're more prone to dying off, that sort of thing. And then using that and then modifying those stem cells to correct that abnormality so that these interneurons from ALS patients can become more normal. And I think that could become the foundation for, a clinical trial down the line. I derive a lot of my inspiration, I think, a lot from my family, I think. So especially my father, my grandmother, they grew up, not very well off in Taiwan, but they were very sort of hardworking and entrepreneurial. And it kind of instilled a sense of kind of work ethic and kind of nose to the grindstone in me, and I think that has kind of allowed me to um, succeed and kind of achieve in ways that maybe I wouldn't have otherwise, as far as, um, going through medicine and neurosurgery and kind of projects in the lab and things like that. So yeah, now that I've wrapped up my first week, I'm excited to kind of jump back into the swing of things and get our hands dirty again and really make some progress in the lab and make some great discoveries on our research.